Well, thank you all so much for your introductions. Those were beautiful. My first question that I wanted to ask was for Tanel, and how did you choose your specialty? And any other genetic counselor can feel free to answer that question as well after Tanel.
Thanks, Elise, for that question. So I will definitely say that my specialty as far as going into the sales aspect of being on the laboratory side really kind of in some ways got chosen for me. And I say that because it was one of those type of situations where I had to turn lemons into lemonade. So as I mentioned in my introduction, I was a clinical cancer genetic counselor for 6 years. And I graduated in 2009. So boards were set up very differently than what they are now. But at the time, like when I graduated, we set out for a year and then you sat for boards. And then like if you didn't pass, then you had to wait a whole nother year to take it. So boards was definitely a hard thing for me. And I won't say it's an unfortunate situation because it led me to where I am now, but I did not pass boards successfully and in the 4 attempts. So that's why I said that like my path kind of got chosen for me. But I will say that had I not had the clinical experience that I did as a genetic counselor, I don't think that the sales role would have like come the way that it did. So I thankfully, my first boss that I had was just like, you have something that a lot of our sales representatives don't have, which is you have a basic understanding of genetics and you get cancer genetics very well. And so he said, that's why I would hire you over any other sales rep that has 20 years of that experience because you understand the science. And so that's why I say that my situation of being lemons not passing boards turned into lemonade. So that's how my specialty got chosen for me. I don't think that I would have it play out any other way because I love what I do. I'm still a genetic counselor at the end of the day. I'm still providing education to providers just like I would my patients. I'm still hounding on them the importance of sending your patients to a genetic counselor when you don't understand the complicated cases. And then just also making sure that they select the right patients for testing and really knowing how to use that information to empower their patients when it comes to their treatment and the rest of their family members. So that's my story.
Oh, that's amazing. I have not heard that story, and I'm so happy you're here to share your platform and tell that story. Thank you so much. Is there anyone else that wants to add about how you chose your specialty?
I'll just say, like Tanel, I think my specialty chose me as well. My experience is a little different. And one of the things that I really enjoy about being a genetic counselor are the number of options that we have available, right? So when you train to become a genetic counselor, you're trained in multiple different specialties. So we have pediatrics here, we have oncology, research, cardiovascular, and I think that's amazing. So if you're in a spot where you're not comfortable, that it doesn't feel like a good fit to you, you have options and you can explore them very easily, I think. So I really enjoy that. So that's what happened with me. I started in a specialty that I didn't really enjoy. It didn't feel like a good fit for me. And then an opportunity became available in oncology. I did not think that I would ever end up in oncology, but I jumped at it, took a leap and loved it. It was the perfect fit. It really allowed me to explore passions I did not know that I had. So it really was an opportunity where it found me, and I'm glad that it did.
So powerful. Thank you so much. I'm so excited for this field and where genetic counseling is going. So for my next question is towards Matthew and Shayla. What was your deciding factor in choosing which setting to work in? And it could be oncology, prenatal, and we'd love to hear more about it.
I guess I'll take this one first. So like Tanel and Tiffany, my specialty kind of chose me as well. As I said before, I graduated in 2020 in the middle of the pandemic. So that made getting a job very difficult. I accepted a job offer in January of 2020 in actually oncology genetics, which is the specialty that I went into school knowing that I wanted to pursue. I had a job offer and then the hiring freezes hit and they could no longer offer me the position. So I kind of had to take a leap of faith and just apply to what was available because I needed a job. And my second favorite specialty was prenatal. So I was like, okay, even though I've structured my whole life around, not my whole life, my whole schooling and rotations I chose around being a cancer genetic counselor, I like prenatal, so let me try this out. And I applied to a prenatal position and I got it and I absolutely love it. And I think it's really funny and kind of divine because prior to deciding I wanted to be a genetic counselor, I wanted to be an obstetrician and I'm working in obstetrics and it's like everything kind of came full circle. So really nice. And I thoroughly enjoy it.
My choice, I would say a little in contrast, I definitely actively chose cardiology. When I first applied to become a genetic counselor after graduate school, unfortunately, I didn't get my first job. I applied to an oncology job here in town because I'm from a Virginia boy. I wanted to come back to Virginia. It's where my wife and I wanted to settle down. And I didn't get a job when I first applied. And then a couple months later, fortuitously, a position opened up in general and pediatric genetics, which I loved for many years. And then an opportunity presented itself at our hospital where I started to sort of advocate for a colleague of mine who was covering a maternity leave position to let's create a cardio position. We know these patients are out there who have inherited heart diseases. They're getting taken care of by cardiologists and cardiothoracic surgeons, but there's not a genetics presence yet. And what ended up happening is that colleague that I was trying to find a job for ended up moving, but I fell in love with the specialty itself. What spoke to me about it was the actionability of it. There's information we can use through the genetic analysis and the family history review that I focus on that can then help people avoid having catastrophic things happen to them. And then we can prevent issues from happening to their families. And so I worked really hard to write up a business plan and present it to leadership at our hospital to sort of say, hey, I can see one person with an inherited heart disease. And because like a lot of genetic disorders, there's a 50% chance of a family member having the same thing. If we recruit those individuals, bring them into our system, diagnose them early and treat them, we're helping their family members, we're helping them, and we're bringing in new patients. And so fortunately, that got the support that it needed for the position to be created. And I love it.
Thank you both so much. It's so great to hear the highs and lows of genetic counseling as well. It's very important to highlight. And that leads me to my next question, which is actually for Erica. What is the hardest thing about genetic counseling, in your opinion, or about the genetic counseling field that you have seen so far?
So I can only speak to my experience so far in my 2 years. So I would say the hardest thing about being a genetic counselor sometimes is the emotional toll that it can take. So for me, because I see children that have genetic conditions, families sometimes can be appropriately heartbroken and they continue to grieve. And I am only in their life for a snapshot in time. And so sometimes you have to weigh this ability to want to give as much as you can because you want this family to eventually come to terms and be okay with, this new chapter in their life. But you also have to realize that you are there for a limited amount of time. You are there for a snapshot. And sometimes that distinction or having to take a step back and say, this is what I can do, this is what I can give. And you kind of have to, and they move on from our practice is hard. It's something that I think for me at this time is the most difficult because you sincerely want all of your patients to do well. You want them to succeed. You want the families to be very active. You want to try and give them as many as many resources as they can handle, but sometimes nothing is enough. And you have to be able to say, all right, you are a healthcare provider. This is what you do, and move on. So that would be the hardest thing right now for me.
Thank you so much for sharing. That was so powerful. And it's great to hear the challenges as well that occur and that you've seen, because being a student is also really helpful, a recent student, in helping for prospective students to decide. Okay, so I have my next questions, and this is open to any genetic counselor to answer. What advice would you give someone who's considering this type of job or field?
Stab at that one. I think one of the key things is to really be familiar with what genetic counseling involves, which is, what part of what you're doing today by looking at this video, but then through that, seeing how you can make yourself a competitive applicant. And part of that process is exposing yourself to as many genetic counselors as you can. And even if that's just an email with questions and getting responses back, or whether you're able to get someone on the phone just to talk to them about what their day-to-day is like and talk to them about their challenges and what they like about their positions. Getting that feedback from different counselors is great to just making sure that this is a choice that you want to make for yourself as far as your own career, and then being able to communicate that when you do go out and do your interviews, when you're applying for programs. And then the other thing I would say to prepare yourself would be to make sure that you do get some kind of counseling experience. And it can be anything from working on a text crisis hotline to doing a phone hotline, anything that forces you to work with people who are in a crisis, because as you've heard, sometimes we are dealing with families who are in crisis, and being able to establish that rapport with your families, relatively quickly is what's important. And it's also really hard to teach. So it's something that just comes, it's innate, and then it also comes with practice. So, those kind of experiences can really lend well. And then that can be expanded. People who have genetic conditions sometimes have physical disabilities or have intellectual disabilities. So anything that exposes you to working with people from those communities is very valuable. It just helps to expand your own level of appreciation and acceptance for individuals that are different. And that also is something that's important to come across and to get across when you're doing interviews and when you're applying to programs. So those are a few things that I would say are important as far as preparation.
Fantastic, thank you.
I can add something there. That was very comprehensive. But as a research genetic counselor, I think I'd be remiss not to add on that many genetic counseling programs have a robust thesis project that they expect students to complete. And so because of that, it's helpful, it's not necessary, but it is helpful to have some experience being part of a research project. So if you're an undergraduate student, I think it'd be important for you to seek out those types of opportunities, either summer internships or approaching one of your professors to find out what type of opportunities, going to the Career Center, talking to different people who can connect you to internships. And of course, a plug for Golden, we're trying to make sure to connect students to different opportunities as well. And we constantly send out resources, maybe too many emails, and we're trying to figure out a way to better house all of our resources. But we really do want to make sure that aspiring genetic counselors are aware of different opportunities to shadow other genetic counselors, like Barb was talking about, but also have internships and other types of experiences which make you a more competitive applicant. Thank you.
Thank you. That was amazing. Thank you for adding that on. I guess my next question would be, what previous professional experience have you had that helped you most in your current role or even getting into genetic counseling school?
Sure. Yes, I can. Yes, I can speak to that. So I spent a year and a half as a genetic counseling assistant at a small a small practice in Fairfax, Virginia. And they were serendipitously a general genetics practice, and they also saw lysosomal storage disease patients. So for me, once I got out of school, that was exactly what I do now. But I think that one of the things that is important in trying to figure out if genetic counseling is for you is to not only, there's always the patient aspect and what do we do as direct patient care, but I think a lot of people don't understand what we do on the back end. And being a genetic counseling assistant helped me to figure out what do genetic counselors do on the back end. I mean, that's different for everyone, but for our practice, it was trying to set up the prior authorizations for insurance and all of that back and forth communication with families, talking to different drug reps about treatments. And so for me, it was really helpful to not only see the patients in that practice, but to also think about, well, what is the genetic counselor doing on her admin days, his or her admin days. So that was helpful for me, not only in what I do now, but in school as well, and in the interviewing process.
Thank you so much. Thank you for sharing. Does anyone else have anything to add?
I have something to add. So prior to going to GC school, I got my master's in public health genetics. So that was an experience that really shaped the way I think about my patients, because in public health, you see a person as like more than just an individual. You see like a group of people, and how can you help? What can you do to help the most people? And so I kind of take a holistic approach when I think about my patients, and I see them as more than just the individual in the moment in which I'm seeing them. Like I see what is their socioeconomic status, what are their factors going on in their environment, what's influencing what's going on in their life. And it really helps me to understand them on a different level. And then I feel like I can serve them better because I can see them as more than just, oh, you're coming here because you had a high risk screen for Down syndrome. Like what else is going on? What are the like upstream effects that are affecting your life? And then also besides that, I was also a genetic counseling assistant. And like Erica said, it's really nice to see the back end things. And I knew that I chose the right career field because I was only doing admin work and I was still enjoying it. So I was like, if I can do the boring things and I still like going to work every day, then this is going to be great. So that's my experience.
Awesome. Thank you so much for sharing. Well, there's only a few minutes left, so I'll ask one more question, and then if everyone can kind of say their last thoughts on what's one thing you wish somebody would have told you before going into genetic counseling or starting your genetic counseling career.
I think probably the one thing for me is that, I knew that genetic counseling school would be hard, but in addition to like school and juggling rotations and also working, I think like that's the aspect of it that I wish I would have had more information on, because it really does, like while you're going through school with the rotations in class and preparing for your thesis, it really does prepare you for entering real life as a genetic counselor, because you have to juggle so many things. It's not just work, you've got stuff going on in your personal life as well. If you're married and have kids, like all that kind of stuff gets factored into it. So it's worth it for sure, but just know that you're going to be wearing multiple hats. Time management is everything. And yeah, just find a good way of having work-life balance. Because in the beginning, I was that new GC that I took work home with me, and I never had like a divide between the two. Now it's a little harder because it's COVID and everybody's like working from home in some capacity. But that was one thing that I had to learn on my own, is that you have to have a good balance between the two, because if you don't, burnout is real.
Thank you so much. Matthew, do you want to go next for one thing you would add?
Yes, thank you. If I could go back and tell myself something before I started grad school, I probably would say two things. One is, you can do this. it took me until I finished my first year of grad school where I felt confident enough to buy a t-shirt from the grad school program and a bumper sticker to put on my car, or to like put in my office, because I don't like bumper stickers. So that's one thing. The second is find a mentor, find somebody outside of the program, find somebody who's like you. And I know from going through that experience, even over 10 years ago, to being able to serve as a mentor for genetic counseling grad students now, how much of a difference it is just to have somebody to share experiences with, experiences of being Black, experiences of being a poor genetic counseling student, experiences with the commute to do your rotations, which you love, but you got to sit in the car for a while, experiences with trying to form relationships with your classmates and how to deal with disagreements with the professor. Like having a sounding board. I had a great support in my program, but I would love to have found someone at that time who could have been a mentor for me. And so if you find yourself in that situation, please take advantage of the many of us who want to serve as mentors for you, because you can do this.
Thank you, Tiffany.
I could not agree with Matt more. I think if I could go back and talk to my younger self, I would really tell Tiffany, find community. It is so important. I attended Sarah Lawrence College, as I said before. At the time, it was the largest genetic counseling program in the country, and I was the only Black student. Sarah Lawrence College is a predominantly white institution, so there aren't a lot of Black faces on campus. But I just put my head down. I did the hard work and just kind of pushed my way through. But now looking back, I realized how I kind of put myself in a situation where I lacked support. Well, I didn't put myself in a situation. I was in that situation, and I didn't know to reach out and to find other individuals who looked like me, to ask questions and to really benefit from their support. Even when I became a genetic counselor, for the longest time, I was the only Black genetic counselor in the entire state of Virginia. I'm glad Matt is here now, and I think Tanil is also in Virginia, but it was just me. And I didn't know to reach out and, build community and network with other Black genetic counselors. And I wish I had. So that's what I would say. I'm just agreeing with Matt. Find your community, even if it's not in your program, if it's in your school. Through Golden, that is why this organization was created, why we have this video, this panel, and we are really trying our best to reach out to students who are interested and help them to receive that support so they don't have to do this alone. And I agree also that you can do it. Believe in yourself. It is competitive, but there's a space for you in the program, so just believe that.
Thank you so much, and thank you for the personal advice. Okay, Shayla, what would you add?
I just want to reiterate again the importance of mentorship. That is something I was severely lacking when I was going into trying to get into the field of genetic counseling and during my first year. When I was in school, I was the only Black student. I went to Stanford. There was not a lot of Black students on campus. I felt like a square trying to fit in a circle constantly. And I just felt really isolated and alone. And I remember I shared with one of my rotation supervisors one day who was white that I wish that I had someone Black to talk to, like who was also a genetic counselor. And she found somebody for me. And to this day, this woman is still my mentor, and she changed everything for me. And it's so important. And the network that I've gained through her mentorship has been I can't even put it into words. So I think coming into a field where I think we're less than 2%, it's really important to have that mentorship, to have that community, to have someone to lean on, and getting it sooner than later can change your entire graduate school experience, in my opinion. So I would just echo everything that everyone else is saying about that.
Thank you so much. And for Erica, how would you close? What is one thing you wish somebody would have told you before going into the field?
I think, first of all, you all have echoed a lot of the things I would tell myself. But I think for me specifically, and I think for a lot of people that are applying and new grads, this idea of being afraid to kind of go for it. I think that When I started applying, I was afraid that maybe I wouldn't get in and what would they say and all of these types of things. And I remember holding myself back in ways that I didn't even realize I was doing because I was just afraid of the perception of what other people would think about me. And I shine when I am my best self. And I think that sometimes we forget that you are uniquely you. We all have different experiences. If you're afraid because you don't have that one class that you feel like every school is going to say, no, they're not going to take you, call them and ask them. Like if you're afraid when you're in school to try this one thing in a session, try it. That's the reason you're there. You know, like I felt like a lot of the times I was just so timid in what I wanted to do and what I didn't want to do. Just go, be yourself, do your thing, because most of the time it will be a rewarding experience at the end of the day. So that's what I would tell myself before school and now, basically.
Thank you so much. Thank you. Thank you all for answering these questions. That was amazing.
All right, so thank you, Elise, for moderating our session and our panel with all of these wonderful genetic counselors. I cannot thank them enough for their time and for sharing their advice, sharing their experiences with us today. And so I hope that this has given you some insight as to what genetic counselors do, to how valuable this profession is in terms of healthcare, and how much we need you to be a genetic counselor. So with that, I want to thank the New York Mid-Atlantic Caribbean Regional Genetics Network, which has helped us fund and support this video today. And I'm going to turn it over to Grace.
Thanks, Barb. So I just want to echo everything that Barb said. The panelists, you were all wonderful. Thank you for being so vulnerable and so open and honest. I think that's the way that will help to motivate, encourage people to join us and be part of the field. So if you're interested in becoming a genetic counselor, just know that there's this group here, this community here that wants to welcome you, that wants you to be part of our team so that we can make change and do better when it comes to genetics and reducing health disparities and just making sure that genomics is available to everyone and that everyone benefits. And so we have other content as well. And so what you can do is you can follow us on Twitter, Instagram, and TikTok. Our handle is @GoldenDNA2. We also have an email address, so please email us. Our email address is geneticsgolden@gmail.com. And let us know if you're interested in becoming a genetic counselor. You'll be part of all of our networks. You'll get our information. We'll make sure to keep you in the loop about different resources and opportunities. Thank you for viewing. Thank you, everyone.